Good evening, everyone. My name is Dr. Leanne Ward, and I'm a clinician scientist in Ottawa at the University of Ottawa and the Children's Hospital of Eastern Ontario. And it's my distinct pleasure to welcome you to this evening's webinar. I'm going to share my screen to kick off the evening. I just have a very short introduction just to orient everyone as we go into this exciting webinar with a partnership with Soft Bones Canada. So the webinar this evening is part of the 2024 Triple CBH and CARDS virtual series. The Triple CBH is a health professional advocacy group that is designed to educate and bring together health professionals in the study and care of individuals with rare bone disorders. And its companion affiliate, the Canadian Alliance for Rare Disorders of the Skeleton, is a patient advocacy group where we link with patient groups in order to amplify the patient voice. And tonight we're so delighted to be partnering with Soft Bones Canada. So as I said, we have this partnership with Soft Bones Canada that began a few years ago, actually. So this is not our first webinar with Soft Bones Canada, but one of the few that we've carried out so far. And it's always a pleasure to talk about hypophosphatasia and to delve into some of the issues that the community across Canada is dealing with. And I'm so thrilled tonight that we have representation across the country for this discussion. So thank you for coming. We acknowledge that the land on which we gather is the traditional unceded territory of the Algonquin and Anishinaabe people. The Algonquin people have lived on this land since time immemorial, and we're grateful to have the opportunity to be present in this territory. So this evening, we're talking about the psychological impact of hypophosphatasia. Of course, living with any chronic condition is challenging, and certainly one that's characterized by the potential for pain and other multi-system issues is one that certainly can have psychological impact. And so we're happy to be talking about this and learning from the community this evening and sharing ideas. So this topic has been put forward by Soft Bones Canada, and we have put together in collaboration with Soft Bones Canada the agenda that addresses this issue. Our keynote speaker from the hypophosphatasia community this evening is Jennifer Paulson-Brand. Jennifer is the president of Soft Bones Canada. So for those of you who may be new to the community, this is a key person for you to get to know. And we thank Jennifer for coming and speaking to us this evening. And we have a number of hypophosphatasia community representatives here, individuals living with the condition or living with a loved one with the condition. And we're looking forward to hearing from them and sharing their thoughts and ideas and their experiences as they journey with this condition. It's always a pleasure for me to work with the delightful Dr. Cheryl Rockman Greenberg, who's a distinguished professor in the Department of Pediatrics and Child Health and in the Department of Biochemistry and Medical Genetics at the University of Manitoba. Cheryl is no stranger to the hypophosphatasia community. She has long worked as a medical geneticist with families living with hypophosphatasia. She was part of the inaugural aspartase alpha trials in Canada, and she's been a real guiding light for this community, individuals living with the condition, but also healthcare providers like me. And Cheryl, we so appreciate that you've come this evening to share your wisdom and to help me moderate the webinar. We do have a keynote address from a healthcare provider as well, who will be talking about the psychological impact of hypophosphatasia, followed by an Ask Me Anything session with Dr. Natalie Truba. Dr. Truba is a pediatric psychologist and in the psychology and neuropsychology departments of Nationwide Children's Hospital in Columbus, Ohio. She's a clinical assistant professor there in the Department of Pediatrics and hails from the Ohio State University College of Medicine, Columbus, Ohio. And I've worked with Dr. Truba in a number of forums, and she's a very gifted speaker and has a tremendous insight as a healthcare provider into the journey of individuals that are living with chronic conditions that are complex, requiring multidisciplinary input. So thank you so much, Dr. Truba, for making the effort to be with us this evening. I did mention the event is being recorded. Happy to edit out any sections that you would rather us not post on the website. You just need to email me at the email address you see there, and we'll be happy to take care of that aspect of the webinar. We want this to be interactive this evening, so there's lots of ways that you can engage. First of all, you can raise your hand and ask to speak. You can put a comment in the chat, and either way, you can bring your voice forward. If you would prefer to sit back and just listen and take in the information, that's absolutely fine as well. So you decide how you want to engage, and our job is just to shed some light on the individuals who do want to speak and otherwise provide some things to think about as you hear these discussions for those who would rather sit back and listen. The event this evening is part of the, as I said, webinar series that's put together by the Triple CBH and Cards Steering Committee, and it's a pleasure for me to work with these delightful healthcare providers and administrators across the country. And I want to specifically acknowledge tonight Nazrin Khan and Serdar Kilikarslan, who helped me with the administration of the cards program. The webinar lasts usually an hour to an hour and 15 minutes, depends how chatty you are. So often it can go past the hour, and we're happy to support that dialogue if it does. And then after the dialogue is over, we'll have a virtual catch up over coffee, meaning we'll stop the formal part of the webinar, open it up, and you guys can chat and just sort of share how you're doing and get to know one another, especially if there's somebody that's new to the Soft Bones Canada community. And so with that, I will stop and turn it over to Jennifer Paulson Brand, who's going to share with us her journey on the road of HPP in terms of the psychological impact of this condition. So Jennifer, thank you so much for being here this evening.
Thank you very much, Dr. Ward. It is really a pleasure to be here, and it's such a nice opportunity for us in the hypophosphatasia community to be around so many of our loved ones and greatest supporters, Dr. Greenberg, Dr. Ward. Thank you to everybody who's here supporting tonight and to our patients who joined us. It's of course, as many of you know, my connection to HPP is that I have two daughters with a recessive form diagnosed as very young babies. And so it's very personal for me, of course, this journey. And I think the same is probably true for all of our patients. I put some notes together to kind of guide my thoughts, and listening to your opening, Leanne, I do wonder how much of our experience really is common to other conditions with pain, other rare diseases, but some of the things I think are a little bit specific to HPP. For us, I would say my personal experience, I was very fortunate to feel confident advocating for my kids when they were little, when we were seeking diagnosis, and to so quickly become connected to Dr. Greenberg and her clinic in Winnipeg. Now, in my role here as a director and president of Soft Bones Canada, we're seeing many, many patients who don't have that. We especially see adults seeking diagnosis and very much confounded by what's going on with their bodies, what can they do to help themselves. And so I think that the words we're going to share tonight around psychological impacts might reach pretty deep with a lot of our patients. For me, most definitely, one of the things I found very challenging is dealing with my children who are in pain all the time. They're in pain physically, they're in pain psychologically all the time. And so much of it is invisible. We don't know it until we talk to them, and we don't know how to help them. So they might be in pain from their bones, or they might be in pain for their injections that they're taking, or the damages it's causing on their skin. But there's other things too that unless I really probe under the surface, I don't even really know what's going on with them. I remember one day my little daughter, who was about 8 at the time, had come back from camp where she went overnight and had this great experience. And I asked her, how was it? Did you make friends? And she said, I made a really good friend, but on the last day of camp, I felt like I had to ask them, what would you do if your friend had a disease? And she said, oh, the friend said, no, like I wouldn't want to have that. And it's, I'm really glad that she shared that with me, but it just kind of a peek under the hood, of what's going on for some of these kids. I know my youngest daughter is often talks about her broken body, and all, like, it's so deep for her, and I don't even really know how to help her. Right. So we're trying, and we're fortunate in the sense that we do have access to the aspartame alpha therapy that is right now the only drug therapy available. But by no means is it a silver bullet. It doesn't cure the condition. It helps with certain things, and it gives me hope as a parent that as she grows, she's going to get the strongest bones that are possible. But by no means does this cure the condition. And now we're seeing the girls growing up into adults. I know there's other parents on the call here of HPP kids, and as our children are becoming adults, we're always worried about, well, one of the big ones is access to the medication. As we all know, the Strensiq medication is definitely much more available for pediatric patients than it is for adults. And so there's always these questions, meeting criteria to stay on. In preparation for this call, I was able to reach out to our community members a little bit, to have patient voice represented, and they are telling me they're people are really, really concerned about how to get access to the medication or how to keep access to the medication. Some other things that I think that I'd like to share is, as a parent, that some of the stress is just simply logistical. I've got to say that some days for my kids, then they have a very severe dental presentation. They're perhaps considerably less severe in the skeletal than some people, but very severe dental. And I've got to say, we've got 4 dental specialists, and rarely does a day go by when I don't have to contact one of their offices about something. I've also been very, very fortunate, I would say. Again, I think it's partly because I'm confident enough to advocate, where I've been able to get some help with finances. But even with help from a province financing all the dental work, I'm still having to claim up to 10% of my income every year as a medical expense. And so it's significant, what we're dealing with. I know for my children's father, for us to coordinate what's going on with the medical is almost impossible. So the amount of stress on that, who's going to call this, who's going to call that, who's going to sign this form, who's going to go pick up, medication. It's almost every day. There's this sort of demanding element to it. When I reach out to patients, I'm hearing themes that are a little different than what I personally have experienced, but I am hearing the same story from almost all of them, that our patients are feeling stressed, frustrated, and in pain all the time. And so when I think about some of the patients that I've spoken to are such strong, resilient people, and just to hear their experience of always living under that, always feeling like my colleagues don't know what it's like. They ask me, how am I doing today? And they don't know how to answer, right? Because, if you start to share, it becomes more stressful for everybody. But some of the patients are saying, to have a headache every day, to have brain fog hit you at any time and not being able to focus, to constantly have your legs in pain, to always be worried that your body's going to fail you and that you don't even know what to do. And then underneath that, to know that this is chronic, it's not going anywhere. Even if they do get access to the Strensiq medication, that's not going to solve all of this. These are still going to be lifelong worries. I know for me, I think about my kids and all the heroics, and I think that is the right word for the dental that we have gone to, and then they lose teeth, and it still happens, and we're trying and we're trying and we're trying, and almost many of the patients, I don't want to say all, but many of the patients that I've spoken to, they talk about a hopelessness that occurs at different times. I don't want to say depression, that's not really fair, but depressive kinds of feelings. What am I going to do? One of the questions they have is, I don't even know what would help my body. What really is the optimum nutritional regimen? What is really the optimal when they go to physiotherapist? I've heard from several patients, the physiotherapist kind of babies them because they go to Google, they hear about HPP, they don't really know. We at Soft Bones Canada try to help educate, but of course we can only do what we can do. So they might go to Google and look up, oh, this bone condition. So medical practitioners who aren't experienced will sort of baby them and maybe not get them the treatments that they need. I've also heard patients talking about how they're trying so hard, but they cannot necessarily fulfill their roles the way they want to, the way they otherwise could be, whether that be as a colleague, as a parent, as a partner. People worrying prematurely, shall we say, about aging. What am I going to do? I'm in my 50s and I'm feeling like I need the care of my spouse as if I was 20 or 30 years further along and I don't know what to do about it. Parents saying that, the expressing the experience of having your toddler run to jump in your arms and give you a hug, but you have to stop them because you're afraid that something's going to happen. And your children always knowing that this is present in the home and that they're worried about their parents. This is something no parent wants their child to be worried about them, let alone all the time. So I'm really grateful for all the patients who shared with me. I know that I can relate to a lot of these things. So yeah, I don't know. I'm sure there's going to be more that comes up in the chat. I really appreciate with this session we have that opportunity for the open chat, because our patients that are here, we really do want to hear from you. And at Soft Bones Canada, we are a very, very small charity, but we really are trying to, at the very least, help patients feel connected, feel a little bit less invisible. Like, we know what it's like to live with this invisible disease, and you meet people all the time, and nobody knows what you're dealing with. And I think if we can, even just in a small way, make people feel a little less alone, that's an accomplishment. So I think with that, these are Cole's notes versions of my thoughts on the matter. So thank you, everybody, for listening.
Oh, Jennifer, so much. Thank you so much for sharing. I can appreciate it. It's not easy to think about how you're going to triangulate on everything that you want to say, and I think you really did a great job of setting the stage here this evening. Some of the things that you said that just really struck me, that individuals with HPP feel stressed, frustrated, and in pain all the time. Right, that's a big burden to carry, and worrying about the future, worrying about aging, and worrying about their children, and all the logistical management of the condition on top of living with the symptomatology of the condition and the impact to your life. So very, very challenging indeed. And I appreciate your sentiment that you really want to open things up tonight and, understand each other and understand each other's journey, and together strategize as well. So Natalie, I saw you really nodding a lot throughout Jennifer's sharing moment. And do you have any reflections on what struck you about what she said this evening?
I share being struck by the same thing you were struck by. I think that the thinking about the future and thinking in yourself, I'm a pediatric psychologist, so I was thinking the span of kids and children's illness and parents taking care of them. But developing as a human whose parents maybe have to interact with them different, and making sense. I think it's just such a layered diagnostic journey, either as a child or as a parent, either or. And we don't evolve, we don't develop as humans by ourselves, and we're raising our parents just as they're raising us. And so there's a lot that can kind of snowball with those seemingly small things up front.
Mm-hmm. Yes, exactly. The snowball effect, right? Just things amplify over time, and the longer you live with a condition, they amplify as well. Cheryl, what are your reflections on what you heard from Jennifer this evening? Oh, you're on mute.
I was just taking some notes just to organize my thoughts, and I think Jennifer said something that, the HPP journey is personal, very personal for each patient, each family, and for the health professionals. Speaking as a health professional and as Leanne knows, it becomes very personal for us as well. We want to do the best, particularly when we see children and adults in pain all the time. Um, and when Jennifer says, voicing things where your child is saying that they feel that their body is broken. I mean, you know, I know as physicians, we want to heal, but we need to heal them in every aspect. So, and I know from speaking with many patients that this is certainly an important component of HPP, and not one that we understand very well. It's not I don't think it's just the fact that it is a chronic disease. I think there is something intrinsic to HPP that we're really trying to get a handle on, in terms of the energy deficit. It's more than just bone disease. And I think that's the beauty of this kind of a seminar and webinar, because this disease, as the other disorders of bone, go beyond the skeleton. So I don't know whether we have to rename it the Canadian Alliance for Rare Disorders of the Skeleton and beyond, but I think we're talking about a topic that really does go beyond the bones. And I think we can all relate to it. We as health professionals, I mean, our greatest teachers are our patients. So, and I think it's very hard to try to help meet the needs when, psychologically, patients and their families and caregivers, are in pain. But on the other hand, we have seen so much success in the treatment of HPP. And if we can add this psychological dimension that people and their families feel supported, then I think that we are making headway.
Yeah, thank you for that, Cheryl. And I would agree. There was a study published a few years ago looking at mental health in children with HPP, and they suffered from sleep disorder, attention deficit, hyperactivity disorder, and anxiety, among other mental health concerns, which suggests to me it is beyond just, as you say, dealing with a chronic disease in terms of coping, that there's probably an intrinsic link to the condition itself.
I'm very interested to know from Dr. Truba strategies for patients and families and care providers to cope. It's to me, a lot of it has to do with coping. If you accept the fact that there are issues from a psychological point of view that are intrinsic to disorder, how do you cope?
Exactly. And I know Natalie's going to give us her keynote in a moment. I just want to reflect on some of the comments in the chat here. Jeremy and Mel, thank you so much. We've got some real appreciation, Jennifer, for your opening, dialogue here, getting things going, and people talking about how encompassing it was, what you had to say. And Jeremy says it can be overwhelming for kids to the point that they just don't want to deal with it. Cheryl, don't we see that in the clinic where they're just like, I just don't want to have this condition, right? And so that's a challenge for kids. Adults can see the big
And
picture.
adults too.
Yep. Yeah, for sure. And Jeremy says adults can see the big picture and endure the shots, but sometimes kids just want to figuratively forget about it. And it can be a especially profound struggle for the children. Well, thank you for those reflections. Does anybody want to reflect on what Jennifer said before we move to Natalie's keynote, where she's going to try to give us some tips on coping? Linda says, as parents, we need to find help as children transition to adulthood. Yes, transition is important. Transition of care, but also transition from childhood to adulthood. Thank you, Linda.
And also the psychological stress on parents who have to let go, when they've been so incredibly engaged and responsible for the care of their children, and all the challenges of letting adolescents go anyways, into early adulthood. I think that's a whole area that is particularly challenging in hypophosphatasia.
Jennifer, can I ask how old your daughters are?
Yes, most definitely. And I was almost thinking of unmuting anyways to just comment a little bit on Jeremy's chat and Linda's comment in the chat. Because one of the things that I sort of had in my notes that I didn't, well, first I'll answer your question, Leanne. My girls are now 14 and Simone will be 17 in a few days. Yeah. But this comment about how overwhelming it is for the kids, and I had a nice talk with Linda earlier about, about watching our children just really not equipped, like really just not equipped to handle this. They don't even know the psychological stress that they're under. And one of the things that I can share, I have had to deal with, unfortunately, with my adolescent daughter is very serious mental health problems, which I don't think it's right to have a causal relationship with HPP, but I do think that it has played a role. And we unfortunately are hearing from quite a few members of our community history of substance abuse and this idea of self-medicating, where, again, not really sure how to help, how to relieve the pain. And enough people are reporting this to us that I'm wondering how prevalent really is it in our community that people unable to cope are now making mental health and physical problems even more problematic. Mm-hmm.
That's a theme we talk about. You mentioned that there's probably some overlap with some of the other rare disorders, and certainly in the X-linked hypophosphatemia community, there's that same story of people really needing analgesia and getting it, where they can to help them get through their day. And so I think that substance abuse certainly can arise from chronic pain and also the anxiety of dealing with these complex disorders. So thanks for sharing that.
Thanks, Anne.
Does anybody else have anything they want to share live before we go to Dr. Truba's short keynote address?
Hold on. I do have a poem I want to share, but at the end, Leanne.
Okay, we'll make sure that we reserve time for that,
Yeah.
Cheryl. Thank you. All right, I'll just give it a minute to see if anybody wants to just jump in here. All right, Dr. Truba, we'd love to hear your prepared keynote. I know it's about 15, 20 minutes, and you're going to sort of ground us in some strategies and your thoughts on this space. And I will allow you to share your screen.
All right. Usually it pops up so I can control my slides, but I'm not. Did you get the request? There we go. Okay. All right. Can you guys all see my slides?
Yes.
Perfect. Yep. Okay. Thank you so much for the introduction. I'm really excited to be here with you all. I always learn much more from hanging out with families and than I do, I think, ever teach. So thank you so much for inviting me to be here and talk with you guys about something that I'm very passionate about, which is the intersection of mental health and physical health. So in general, we don't know a lot about behavioral health impact in rare disease space. It's just hard to capture in a big N because of the numbers involved with rare disease. But what we know is that rare disease is incredibly impactful on our physical and mental health because of the things that go along with caring for ourselves. So not only do we see more, risk for mental health and general emotional stress, but a lot of the things that go involved with caring for ourselves when you have a rare disease really make it hard to engage in your community as you would typically maybe do or as you would want, which has a direct impact on quality of life and psychosocial functioning. So you have the whammy of chronic illness, then you have the whammy of how it impacts how you can live life, and then the whammy of the consequence of that on top of other whammies. So a lot of stuff going on in when you're dealing with rare disease. And in general, people with rare disease tend to endorse high rates of lower self-confidence and not feeling supported or understood by others, which is very consistent with kind of what you were talking about, Jennifer. When we step back outside of just adults and kids, and we look at the impact of kids from a developmental standpoint, we see a little bit of differences. And the biggest part with kids is it's twofold, right? One is humans are very social beings, and we have a sense of connectedness that's very important and to our well-being. But we're also developing and being parented. And if you don't have a chronic illness, don't have any rare diseases, your parents are parenting you already kind of like out of their wheelhouse, right? Because we're always kind of catching up societally wise to where our kids are at. So no one ever actually knows what they're doing as a parent, as it feels. And then when you add a rare disease into that, it's even harder. So how do you parent your children to be successful in general is hard. And then when you add a rare disease on top of that, understandably, even a little bit more challenging. One of the big factors that impacts kiddos with chronic illness, particularly those that affect physical abilities, physical functioning, is that they're often encouraged to engage in different things or to do things in different ways than their peers, which really changes their opportunities for socialization, either in a way that they're reduced. So, they're excluded from certain things, or it's modified. So they're kind of like doing their own thing in parallel, right? And that naturally is sort of like socially exclusive and results in this othering, which is why this push for inclusivity is so important. Because the more that starts early and in school, and it's a cultural community approach around how do we have everybody participate in this thing we're trying to do versus like, oh, we participate, and if you can't, then you do this other thing. That shapes mindsets for kids, and they carry that forward. So when you look at the data in schools and other places where they really focus on inclusivity, bringing that in is so protective for kiddos who have physical differences, because it's a mindset of their academic community. And so it's never like them being like, oh, I have to advocate for myself, or I'm the N of one. It's like the whole class is like, well, how's Johnny going to do that? Right. Because this is how we've developed, how we've talked about it. And so it's really that inclusivity and really pushing back on not having like a parallel activity or not having an excluded activity is really, really important. Because that is really a primary space that a lot of kids make friends and learn how to sustain friendships and navigate that. And friendships are really important, especially when you have any sort of difference, because friendships really do lessen the socially harmful effect of bullying. I wish that we could say, like, just don't bully. That would be ideal. There are people much smarter than me working on how to do that for kids. But we can't. And we know that our kids are more at risk when you have a physical disability to be bullied. And so, making sure that we're not making it maybe worse or harder because we are, having some exclusionary activities is really important, advocating wise within the school. Additionally, with children, we're in a space of, identity development and understanding themselves in relation to their family, but also in separation from their family and in relation to their peers. And so the ways kids develop self-identity and the way they perceive themselves can be very negatively impacted by chronic illness and these experiences of sort of social exclusion, or having less opportunity to develop as meaningful the type of relationships that they really want. So not only about themselves, but their beliefs about how others see them. And this kind of can result in this internalization of experience. So the ways people talk, the words that we use for ourselves, the words that other people use for us is really important. One time of hearing something, you might be like, okay, like, I might not carry that forward. But when you hear things over and over, and you hear yourself described away, or other people, you describe yourself away, or people talk about you away, you internalize that, and you're like, oh, I'm not fast, or I'm not good at that, or it's unsafe, and that impacts how you see yourself, the risks you're willing to take, and all sorts of things. And so the thoughtfulness and framing of language and how you're talking about things when you're parenting is really important with regards to how kids see themselves, separate from having a bone disease. And there might be things that you have to navigate around. How do we see ourselves, right? Like, we might see ourselves as maybe a professional football player. Like, I love that, but we maybe can't do that. But that self-identity is not just about being a football player. It's about achievement, and it's about working hard, and it's about all these other values that this kiddo probably has. And so really, not shutting down kids' interest, but being able to talk about it and about their values that drive that is really important for kiddos with rare disease, because there are going to be times that they just can't do the things they want to do because of it's not safe, or because their bodies just won't kind of tolerate that, and it could be very dangerous for them. Because what we don't want is we don't want our kids to see themselves as being inherently less than or as good as others because of the ways that people talk about them, or they talk about themselves, or the ways that people orient to including them, or are kind of structuring opportunities for them to be involved in other things with kids their age. Because we don't want people to see themselves as not capable. And we might have an ability issue, right? Like, we might not be able to do something with our body. That doesn't mean we don't have the capacity to understand, to enjoy, to make sense of the things about that we want. And so we can create, we can problem solve, and we can work to develop a sense of capacity and confidence, even though we might not get our way exactly how we would want it, or the way that we see other kids do it. And so the parenting piece, I think, is very challenging, because parenting a kid is hard. Parenting a kid with rare disease is even harder. Parenting a kid with rare disease that causes a lot of pain, that impacts your ability to engage in things that you want to engage in, and results in physical, sort of very obvious physical sort of impact, is even harder. So why is mental health so important for people living with HPP, above and beyond everything we just talked about? Is it just as a lot, as you all know. And when I initially went through this, I was like trying to identify all the things that could cause pain, and then it just basically got everything taken up. And so when, I think being able to speak that managing this is a lot, but living with this is a lot. And this Pierpont article is one of the few out there specific to pediatric mental health and HPP, which is what Dr. Ward was alluding to earlier. And in this study, they actually looked at quality of life in children. And it was, pretty evident that, sleep dysfunction, pain, poor emotion control, mood, anxiety symptoms were very much related to their sense of how well they were doing physically and psychosocially from a quality of life standpoint. And that is consistent with other rare diseases in children with chronic illnesses, particularly those that impact physical health. So we know that when we're not sleeping, when we have pain and we're having some anxiety symptoms, we have reduced physical and psychosocial health. That is true across the board. What's interesting though about this population is that we have a lot that have that report a significantly impactful clinical behavioral issue, right? 50% of those kids having met criteria for ADHD. So neurologically, right, I think this sounds alarm bells around is not being fully appreciated about the neurological or neurocognitive impact maybe of HPP, which is understandable because we're newly shedding light on that. But that's a lot of kids in a population to have a significant, which means it impairs with how they can function on a daily basis. It's not like, yeah, it's kind of annoying, but like we manage it. These are kids that we are saying that clinically significant, which means there's a real impact either on how we function at school or how we function at home or how we function in some way that has a secondary sort of consequence. 60% poor sleepers. Sleep is so important to our health that if you're not sleeping, your body will literally stop functioning. And so the majority of humans don't get enough sleep. It's particularly true for youth and for us as adults, honestly. But for these kiddos, even more prevalent than you would see in other rare disease populations. And so again, clearly probably relation of pain and other things going on that really is not only impacting how they feel day to day, but like the things that we need to recover and feel better the next day are also impacted, like sleep. And then we see a 30% higher average pain interference, which means we have pain, but this is pain that actually interfered with us being able to do things that we want to do. So there's pain, then we're like, yep, I can kind of function through this. And then there's pain where it's like, I actually can't function with this pain. And we see a 30% higher sort of endorsement of interfering pain than we do in other rare disease populations. But interestingly, they are a group of kiddos who have very adaptive, intact skills, which is awesome. Not only are they very adaptive, but they're pretty advanced. So this is a creative group, a group that is really like probably with the right supports, able to feel better and to do better than they currently are, given the adaptive foundation that many of them have, which is awesome. We might not be tapping into that enough or sort of coaching and teaching them maybe how to rely on some of those adaptive skills in a way that would make them a little bit more successful in some ways. But that's a high rate of adaptive skills to see in a pediatric population, rare disease, to be honest. If we step back and we look at adults and kids with HPP, one of the few studies that I was able to find that made sense to me was a group that was really trying to capture some of the more neurological symptoms. And they looked at adults, they looked at this retrospectively, they did a med chart review, and they asked some questions. And the majority of these individuals were diagnosed in early childhood and able to kind of reflect on some of their experiences throughout life. And by and large, again, very consistent with our pediatric study. So a lot of fatigue, a lot more headache endorsement, and then some of those concerns with gait change that can have downstream effects. But sleep disturbance is very common and fatigue is very common. Headache, obviously very common. The interesting ones to me were vertigo and hearing loss. And I debated keeping them in here, but I think the important part is that as we age or as we evolve, if you have a chronic illness that has a very predictable course, that's one thing. If you have a chronic illness that has a less predictable course, it's hard to prepare and know how to best to navigate or help your kids navigate things that are out of control, that they don't want, that are unexpected, right? These are some of the things that can really have an impact on how you engage socially and how you can do things, not only as a kid, but as an adult, right? Like vertigo can be debilitating. Hearing loss can be socially very challenging to navigate. But then we look out at more specific mental health issues, very high rates of depression, anxiety across the lifespan, and high rates of neuropathy. So, fatigue can be painful, headache can be painful, neuropathy is painful, depression can be painful, gait change are painful. So it's not just about, not bone specific, but the secondary impact of our disease process over time has, sequelae pain often with it as well. And so if I don't look at the kids at under 6 months and I just look at adults and I took about 30 seconds to just like quickly circled the ones that would be painful. I mean, that's a lot of pain. And I think it speaks to what Jennifer is saying, and I'm sure many other parents around the ways that you have to kind of help your kids understand and cope with pain. So I'm going to talk a little bit more in depth about the pain piece today that I didn't talk about last time I was with y'all. So first, when we think about pain and helping people understand and cope with pain, we have to accept that pain is a very subjective experience. It's hard to treat. It's hard to classify because we all experience pain different, and we can talk about a pain experience, but what that actually feels like in our body is likely to be very different for each person. So characterizing, classifying, and treating pain can be very challenging, particularly when you have chronic pain that's sometimes acute, sometimes chronic, and often reoccurring. Pain perception is primarily processed in the amygdala. And so this is really important because we don't actually, the only place we experience pain is in our brain. It tells us, oh, that, that hurts and here and here and here. But pain perception is really important because our brain is a very powerful thing, very primitive in a lot of ways. And this is problematic where when we step back and we look at how do physical and emotional health start to intersect. And emotional and physical pain are a good example of this because our brain and the amygdala does not process these sensory input different, right? So if I burn my hand or if I go through a breakup, my amygdala doesn't know that, right? I make sense of that contextually, and I know I didn't burn my hand, I'm going through a breakup. But from how my brain processed that and my body responds to that as a pain stimuli are similar, or would be the same actually. And so when what we know from our literature and our data is that emotional pain makes physical pain worse, and physical pain makes emotional pain worse. This is why we say depression hurts, because it does. And it's not just emotional pain that's experienced. So if you're somebody that has a lot of reasons to have mood issues, I maybe had an unexpected fracture and now I can't do this thing I wanted to do. And now I have to, I'm off my feet for a bit and my mood is starting to dip because I'm not contacting these things that bring me meaning, right? And I'm in pain. Our pain is going to be worse. And now we can quickly get into these cycles. Same with chronic pain. People that have chronic pain are at a high risk for developing depression, mood disorder, because when you feel crappy all the time, right, that impacts your mood. And so it's really like a very cyclic understanding. The reason why I keep talking about these, I'm going to talk about cycles a lot, is because understanding and supporting the mental health management isn't just about the mental piece. We can't just say, let's work on depression without talking about and incorporating the experiences with our body. Pain and sleep are also very important. And these are two big things in this community, which is why I'm talking about them. Because not only do they impact all sorts of things in and of themselves, but they directly contribute and impact each other. So both have very big impacts on attention and learning, memory consolidation, and recall. Both also can have huge impacts on activity levels and degrees of engagement. So if you're not sleeping, you're more fatigued, you're tired, your pain's worse, you're less likely to move or want to move. If you're in pain, right, you don't want to move. And then we get into this moving hurts, not moving hurts, right? I'm not willing to do that because I'm so tired today. And that becomes a cycle. But with pain, and particularly for tired, our best cells are tired, but with pain, when we have pain, we really are at the risk of developing anticipatory pain. And this is a community I think probably has a lot of anticipatory pain experiences. And when we have anticipatory pain, we actually can unintentionally sort of like trigger other pain experiences in our body, and we can make them worse. And so managing anxiety and our stress response around prepping for certain things that might be painful can be really helpful and important in order to mitigate some of the more intensity of that pain experiences afterwards, or reduce the latency from like recovery from that more acute pain experience. We also have a high rate of chronic pain in this population, which is understanding. And chronic pain is really hard to treat because the ways that we would treat the way we would treat acute pain, like if you have an acute injury, don't really work for chronic pain. So when we get past the acute healing phase, even if we've had fractures or the healing fractures, we get past the recurrent healing phase. Oftentimes the more intense pain will resolve is ideal, but sometimes it doesn't. And then we have to kind of get into some spaces of really training our brains then to respond to, perceive, and manage pain stimuli different. So if I ask, if I were to tell you guys, I want everyone to think about a time that you've left somewhere and you found out somebody had lice. you might notice your head itches. You're like, oh man, I think, what if I have lice? I just left that place. And you notice your head's actually itching. But your day goes on, you get distracted. And then you're like, a little bit later, you're like, wait, is my head still itching? I don't know. I kind of forgot about it. And you're like, no, okay. I think I'm okay. I don't have lice. Right. Just the instance of shifting your attention and be like, oh, could I have lice? Your brain is producing and responding to these stimulus and it's producing sensory stimulus, right? That is sending that message that makes it feel like it's itching, even though it's not. That's how powerful our brains are. So the more that we attend to pain and we focus on pain and we shift our attention to pain, the worse our pain is going to be. So oftentimes in therapy, it's, managing chronic pain is not the aim to have zero pain. The aim is to change the way that we respond to pain and react to pain and cope with pain and interrupt some of those automatic neural pathways that have developed to develop different pathways so our pain perception actually diminishes. And that's actually a very effective therapy. That's kind of how chronic pain management therapy works. And you can see those neural changes on fMRI studies. So it's important, one, because these things are bidirectionally related and the mind-body connection is real. And we literally can't optimize physical health if we're not focusing on mental and emotional health. And we can't have good mental and emotional health if we're not taking care of our bodies. And so these are both interconnected. We're not going to achieve what we want in one space without the other. So the cycles here, and this is a slide I showed last year, but I really liked it, so I recycled it. So this is where therapy is helpful. I'm going to talk about how that looks in a second. So if we have pain, we have limited physical functioning. The natural reaction to that is to avoid, to limit our engagement in those activities that are causing us pain. But these activities might be ones that are really meaningful to us, right? They bring us joy. I'm hanging out with my friends, and now I can't do this thing with my friends that I wanted to do. That's going to impact my mood. Okay, so that's how pain can impact mood. I'm not saying it's the only way. This is a hypothetical example. Like while I'm dealing with my pain, I'm also not sleeping great, right? So I'm getting interrupted, not great sleep. My attention's reduced, my frontal lobe functioning is reduced at school. It's harder for me to pay attention. I start to have difficulty focusing at school, and then my learning suffers. Both these things to be occurring, simultaneously, and often are for many kids with chronic illness, especially those that are painful. Reduced mood, though, also impacts poor sleep. We know that. But reduced mood also makes pain worse. Pain also makes sleep worse. But interrupted sleep makes pain worse. So you can see how we can't just address our mood or our pain or our sleep to really help somebody. We have to kind of conceptualize all of it and come up with a plan that helps us cope with these things, because the realistic and tolerate them and accept them as we were talking about earlier. But the realistic place that a lot of people want to function is, I just want to change this. I want to get rid of this. I don't want this to be the case. And those acts of trying to control things we don't have control are usually where we get the most caught up and causes us the most suffering. And so this is really important, because it's not just a bone disease. This is as much as an impact on mental health, probably on bones. And I think some families would say even more, because we kind of get the bones stuff down, but it's all these internal things that I can't see. I don't know them. I don't know how to pull out of my kids. I don't know if they know. That tends to weigh on us a lot, because we all want, you want your kids to be healthy and successful and happy. And I believe that's possible in having a rare disease. I don't think that every day will be good, right? I don't think that like every moment is going to be one that we're like, yes, which is true for any human. But I do think there's a way to have meaning and find value and feel happiness despite things like chronic pain and other things in life. And so that's why mental health matters, because to have good disease management and to be successful, if we don't protect our mental health, then our physical health is just going to deteriorate, especially as we transition into adulthood and a lot of things become a lot more challenging. So when you think about mental health supports for this community, the ones that I would recommend the most are things like cognitive behavioral therapy that really focus on understanding our thoughts, feelings, and behavior, how these things correlate, how they inform each other, and how I can shape or change or challenge certain internal experiences like thoughts, modify my behavior to shift my emotions or to reduce some of the intensity I'm experiencing internally. Biofeedback is another modality that's really helpful. It utilizes computer equipment to help kind of train individuals in how their body reacts from a stress standpoint, not only to like depression, anxiety, but also to pain, and train them in utilizing their body from a calming standpoint to help mitigate some of those things we do in our bodies that make our pain worse when we're having it. Acceptance commitment therapy is really helpful, particularly for mindfulness related to distressing or painful internal experiences, whether that's physical pain that we're noticing or emotional pain, and improving psychological flexibility to help us kind of cope with things that we can't control and we can't change, and learn to accept them. Doesn't mean agree with it, doesn't mean we like it, but can we accept them so that we're not in a space that of causing more suffering than is kind of necessary as just being a human that's alive. I think trauma-informed therapies can be really helpful for kiddos with chronic pain, particularly kiddos who have adjunct therapies like infusions or other things that cause pain. One, because we don't want to develop a relationship with our medical care that makes it more likely that we'll avoid that when we're adults, because we don't want these things that were scary and hurt us as kids to continue. Psychiatry can be really helpful from a medication management standpoint, particularly for kiddos with that maybe have a harder time paying attention and focusing and sitting still maybe, and or those with a big depression or anxiety that seems to be exacerbating a lot of their pain experiences. Massage and therapies, I think, are always great. The Meg Foundation is a pain management resource that is freely available to patients, families, providers. It's in 12 languages. It's really great. I added this in so people could check it out. One, because they just have a lot of stuff in there that might help parents start to implement within the home, how to talk about stuff, how do you think about pain, how do we understand the function, stuff like that. And then it goes through a CBT model and how and why CBT from pain informed CBT can be really helpful with kind of pairing all of these things together, because it pulls in a lot of acceptance commitment therapy, a lot of biofeedback type stuff. And so for kiddos that have a more of a painful presentation in their rare disease, I think having a pain focused therapist or somebody that can kind of do both and is really helpful. Thank you.
Great. Thanks so much, Natalie. Lots of information there. And I really was struck by the slide that talks about pain and mood and sleep and the interconnectedness of all of those aspects of what patients are experiencing, and the importance of dealing with them all and not trying to just treat one aspect without taking care of the others. So very informative talk, lots of information. We've got questions coming in here through the chat. I guess Cheryl is asking, what do you mean by trauma-informed treatment? You gave the example of a child, or it could be an adult who had some sort of a very challenging experience with the healthcare system, right? Like fear of infusions, fear of blood work. And of course, individuals with HPP have a lot of medical interventions. Maybe they needed surgery, and maybe that caused some trauma. That sounds like that's what you're talking about, is trauma arising from the condition and the way that's impacted their engagement with the healthcare system.
Yes, exactly. So trauma-informed therapies or trauma-informed therapists, or therapists who have a little bit more specialized training in helping kind of work through or reconceptualize, develop different ways of understanding and contacting our trauma that helps us kind of achieve the things we want to do. And so for a lot of times for medical trauma, it's really about experiences that occurred when we were younger, or that we didn't have maybe a say in, or times we had to be held down because we were being very combative, we needed to get blood. And that can like play out in a lot of ways for adults. And so having a trauma therapist can be helpful, simply because they have a lot of really good ways and strategies to help people think about that different and incorporate that into their narrative in a way that helps them kind of not only be re-traumatized, but actually like get through it and be doing it in a way that's healthy. Because what we don't want is avoidance to occur, and then we start to like drop off some of our medical care. That's what we see for adults when they're transition and no one, their parents don't make them, and we can't track them down as easily. And they're like, oh yeah, I don't go to the doctor because like I get held down a lot to get blood, and like I'm not going in to do that if I don't have to, right? Because it's going to be horrible. And so more of that from that lens than like a wartime trauma or something like that.
Mm-hmm. Yeah, fair enough. And in this community, and I'd love to hear from those with lived experience, the treatment can be painful. The aspartate alpha injections can be painful. And I think you alluded to that. I think it was Jeremy who mentioned that maybe the adults can buck up, but the kids can struggle with that. But I'd love to even hear how the adults experience, their treatment paradigm. Anybody wish to comment on your journey as a patient in the healthcare system? Has it been positive? Has it been fraught? Would anybody like to talk about that?
I wouldn't mind if, can you hear me okay?
Can hear you great, Jen. Thank you.
Yeah, I think that the, the it is painful. And I was at something not long ago and I met another patient, and it was interesting how we sort of came together, like, and we're kind of laughing, but recognizing that, yeah, like we don't look forward to it. It is not something, I know it's needle night, and then I think, oh, okay. And my husband does it because I could do it myself, but because sometimes it's quite painful, it's easier if he does it because it does take a little bit of time, right? It takes a few seconds to actually do it. So I'm afraid if it hurts, I'm just going to pull it out. So there's that part. And I think that, so there's the pain part, but then there's the residual effect of it too. So you know that when you put it in, it could be painful. Then it's a bit of an after effect as well sometimes. But I guess the issue is I don't know. It's like a lottery. One time I can do it I do it exactly the same way. I wait the exact same amount of time to sort of warm it up a little bit. I do it in the same places. One side could be super painful, the other side not. So that part of it almost creates more anxiety sometimes because, like, is it going to hurt? Is it not going to hurt? Anyway, and so as an adult, as you said, I can try and be grown up, and just like I know it's good for me, and I'm doing it, and I do that. But I have said to other people, with children, I cannot imagine trying to talk them into it every time you have to do it, and like be like, okay, it's going to be fine. So anyway.
Mm-hmm. That's interesting that the uncertainty of whether it's going to hurt or not creates even more anxiety, right? And I can I
Yeah.
can understand that because you just don't know what to expect and what to steel yourself for.
Yeah, and it
So
sounds like, to use the word anxiety, I don't mean in an extreme way, but even just that
yeah.
momentary, even few seconds of, you kind of tense up and you wonder. So like I said, when I think about it for children, as an adult, I can say to myself, okay, no, this is good for me. If I don't, here's what's going to happen. But as a young person facing this, I wasn't diagnosed officially sort of till I was in my 40s, and I haven't been on drug that long. But, if I was a young child, knowing this was forever, I think it's a very different dynamic too. Anyway, those are my
And
thoughts.
from a learning standpoint, I'm really glad you shared that, Jen. That like intermittent reinforcement, where it's like, oh, sometimes it doesn't hurt, sometimes it does hurt, is actually like the most powerful way of that we like make people learn. And so if it makes it even more challenging because you could have tons of times of it not hurting, not hurting, not hurting, but your brain is now like so well learned of like, but maybe, which is literally how like why gambling is so addictive and other things, because it's like maybe, 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 right? And so like it's like that's where those like the therapies come in, because that's really complicated. It's really complicated from a learning standpoint of how our brains learn to cope and like anxiety. So the more that you like, if you had every time you're like pain, you probably have less of that anxiety response than you do now, where it's like you don't know. It's like, ooh, how's it gonna go? Because like it's more unpredictable for the brain. So like that makes it even more challenging and hard to cope with. And probably like for kiddos especially, and it's not usually anxiety like they're panic attacking and rocking, but it's stress, like their muscles are tight in these things, which make like the stick harder and these other places. And like sometimes it's all these things leading up to it that kind of it maybe would have gone better or not has hurt of bad if we wouldn't have been sort of this like slow amping up, because that's how our brains work, because our brains are very predictive. And so we know that's coming, it's needle night, and your brain's like, oh, okay, like every reminder prompt it sees, it's like, okay, I'm getting more ready. I'm getting more ready. I'm getting more ready. And now it's learned like, oh, okay, and that is a really powerful learning paradigm that this community, I think, it's relatively unique to, probably.
Yeah, lots of challenges there with the pain of the therapy. I've certainly heard one mom said to me, I'm going to need therapy after having to chase my child around the house to give them their injection. Really, really traumatic. And some families struggle to cope with giving the injection and managing that and just say, we just can't do it. So it can be very, very challenging indeed.
Mm.
Cheryl, do you have a comment?
But
Something you want to share?
I just want to make sure people realize that although we do have adults who are on current enzyme replacement therapy, these were either the adults who were on the initial clinical trials or who did get access to ERT on a compassionate basis, but the sponsor and the company has ended compassionate access because that was only supposed to be a bridging program. And seeing as though we don't have approval in Canada for adults, and there was, in their opinion, there was nothing to bridge to, then really access to ERT on a compassionate basis has been stopped now for several years. I mean, there's many attempts for the children who are now adults, they are continuing on drug appropriately, and adults who are on, oh, sorry about that. Hold on. It's adults who, it's just going to ring for a bit again. Hang on.
We don't
Adults,
hear it.
you don't hear it? Okay, good. Adults who are on compassionate drug will still continue on compassionate, but we can't add any new ones on a compassionate basis. And that's why the new clinical trials with the long-acting ERT hopefully will be beneficial. First of all, it's only one injection every 2 weeks. And of course, hopefully that will increase the access to adults, who meet the criteria for enzyme. And we hope that the criteria for adults in any case will change soon in Canada. But I just wanted to clarify, it's not equitable by any means in Canada in terms of access to ERT.
Hmm. Which is an issue, right? This is something that I don't know if you're aware, but the Canadian Rare Disease Network has been struck, and we're trying to look at these issues of equitable access to therapy and access to therapy across the lifespan and et cetera, et cetera, et cetera. So the narrative is out there. We have a lot of work to do. As Cheryl said, I don't know if you're aware of these clinical trials that are going on. What is a clinical trial? It's a research study specifically involving a medication. So it's one that has been registered with Health Canada, registered with the FDA, et cetera. The trial is going on with the goal to show whether the drug works or not and works adequately to be ultimately approved by the health authorities and then ultimately publicly reimbursed. The medication is called F-zimfatase alpha. So the original ERT was asfatase alpha. This is F-zimfatase alpha. And as Cheryl said, the injections are every 2 weeks, and there's trials going on looking at those injections against placebo and looking at them against asfatase alpha in the children who were previously treated. So working away at those, if there's an adult that has an interest in participating in one of these trials or a child, they can get in touch with Dr. Greenberg and myself, and we can get you in touch with the right clinician across Canada that's close to you. So that's something that we're working on. Does anybody else have any thoughts they want to share, any reflections on what you heard from Dr. Truba, or any personal reflections that you want to share? Things that you would like us to know as healthcare providers that you want us to really be thinking about and advocating for? These are some of the things we'd love to hear from you about if you'd like. Jennifer, if I could put you on the spot, if you had to name your top 3 healthcare system things that you would like to see change in order to better serve the HPP community, whether it's with respect to mental health or otherwise. I'm sorry to put you on the spot, but
Yeah, not at all. I was actually just unmuting anyways, Leanne, like I did last time too, because I had my mind stuck on something that Dr. Truba was saying with in response to Jen's comment about the fear of the injections, and it just made me think of my daughters with the fear of their injections. And like Dr. Truba's comment about you not knowing if it's going to hurt or not and how much that can just ratchet up the fear and anxiety. But it made me think about my two girls. One of them is interestingly, much more resistant to the injections than the other one. And so my older daughter, Simone, has experienced extreme needle phobia over her life. We've had to have all sorts of psychiatric interventions over blood work. But for some reason, her taking her aspartame alpha, she's relatively willing to do this. So despite the extreme fear for blood draws, I think the reason that she tolerates it better than her sister is because I think she knows that she has a more serious presentation of the disease. So she went on trial when she was 3. She first received the meds. And at that time, she really couldn't barely walk. She could walk, but she couldn't climb up the stairs without holding on with 2 hands. She couldn't run at all, you know. And so I think she has like a deep understanding that that medication really, really helps her. And she's been less, it's difficult to get her to comply as a teenager, and she does not like the skin damage that it causes, but she's more willing to tolerate the pain. Whereas my younger one, I think partly because she's blessed with having less serious of a skeletal, she does experience pain, but she says, well, I'd rather just have the pain in my hips and my knees that I'm used to anyways, because the injections really hurt her. And she's, of course, also at that age where the skin damage, she's very, very, very self-conscious about it. But that was what was running through my head there for the last moment. But, you know, to answer your question, Leanne, about what would we like to see differently, that's a really great question. I'd have to think about it more. But I do think that if we could have good quality mental health care included for the kids, it would be so wonderful. I mean, I know even in our benefits packages as like working professionals, it can be very, very limited. And I know for me, I'm paying out of pocket big time to help my kids get good access to psychologists. And yeah, that would be just wonderful. But again, it comes down to often to budget and funding. Like, that's for sure one thing. Maybe some other people here have wishes in this regard.
Yeah, I would
Jennifer,
love to. Go ahead.
go ahead, Leanne.
No, you go ahead, Natalie.
Oh, I just want to say I'm really glad that you brought that up, and what you're speaking to is like the importance of like working with your kids and like, and not every kid has this, but the majority of kids do, but finding their values and like anchoring these things that they have to do to them so that they do have more willingness and motivation. And that is another place that therapy can be helpful. Like we can accept, like your one daughter's like, I can accept this pain because like I really, don't want my bones to be as affected. Where your other daughter's like, shoot, I'll take this pain I'm used to every day over that pain. And like that's important. Both are important, right? Because they're both right in the way of like, this is what I prefer. But when you're a kid, you maybe don't always know the consequences, right? Of maybe not doing something. But like, that's another parenting place where if you need some support, but like reach out to Jennifer, she's nailing it. So thinking about just, how do I attach values and the things that are motivating or important to my kids to these things that I'm asking them to do that are hard is important. Like, I'm not going to do things that I perceive no value in and that cause me pain. No human is going to do that, right? Or want to do that. And so, it's not always just about the long-term consequences, which is where you all as parents are like, this is what you need, it's best for you. But sometimes it's those more shorter acting things that really kids can anchor to that are important to focus
on. I think, Leanne, what we've learned is that HPP is not just a bone disease. That's been mentioned several times. And I think we have to indeed embrace it as a total patient and family disease, illness, and we have to certainly address the mental health challenges for sure.
Yeah, 100%. And I think access to mental health is a broad-based issue, and then access to mental health in the context of a chronic illness that has multi-system comorbidities is another layer. And I think that we really need to do better in this regard. Again, to just refer to the Canadian Rare Disease Network, that has just been struck, just getting going, but is trying to move the dial on some of these issues. There's a pillar called the holistic care pillar that is trying to address this and figure out how we can integrate these specialized services tuned to the patient with HPP into the clinic. So that's on radar. And then Jennifer, I was almost sure you were going to say that you would love for the dental care to be covered, right? That this isn't just going to the dentist every periodically and having a cleaning, or you've got a cavity and you're filling it. This is an integral part of the condition and is severe. And we know that not having healthy teeth can interfere with, obviously pain, but chewing and speech development and very, very expensive. And I think that the dental health of HPP is very different than typical oral health care of the average Canadian who is just maintaining their overall health. So I suspect that would be on your wish list too, right?
Absolutely. Yeah. Access to these things, easier access for patients when you do have this pre-existing condition. Yeah, there is some out there, but it takes a great deal of digging and it takes a lot of perseverance to be able to get some help. And we in Alberta, I'm fortunate that I've been able to access some for my children who are under 18. But I agree completely, Leanne, that would be wonderful.
Yeah,
From the
and then in
point
the
of view of dental care, sometimes we've been able to get some of the children with HPP with serious dental problems and adolescents covered on the craniofacial plan that is provincially funded in Manitoba. It wasn't meant for, children and young adults with hypophosphatasia. It was mentioned more for the patients who are born with clefts, cleft lip and palate. But we've been able to capitalize on the broader interpretation of because of the dental problems in HPP and take advantage of, and advocating that this should also be covered and that again, just limiting it to clefts was not being inclusive enough.
That's a great suggestion. I'll have to try to see what I can do in Ontario, whether we can access the craniofacial programming for financial
Well, if
assistance.
you need help in me showing you the language that we use, I'm happy to share it.
Oh, yeah, I don't want to reinvent a wheel that
No,
you've already
no, you don't want to
successfully
reinvent.
made turn. I was really struck in the chat. There's a couple of individuals who have commented that they were diagnosed not in their 40s, not in their 50s, but in their 60s, diagnosed in their 60s. There is a study by Wolfgang Hugler out of the International HPP Registry that says if your diagnosis is missed in childhood, right? So you get through childhood and it doesn't happen. You're not diagnosed and you enter into adulthood, then it's many years before you will arrive at a diagnosis, right? And here we've got examples of individuals in their 60s. I just feel for you, right? To not know why you're having these issues and symptoms and signs, and many of the symptoms are sort of non-specific: profound fatigue, brain fog, headaches, pain, lack of sleep, right? These could be any conditions. But to have HPP and those kinds of debilitating symptoms and not know why you do, I just want to say I feel for you, those individuals tonight who have shared that with us. And aren't we, Cheryl? We're trying to teach individuals to pick up and to check an elk phos. We're really trying hard. But it's not easy to reach every doctor in Canada and send that message. You've got someone with profound fatigue. It's not getting better. They've got non-specific pain. You've got to measure an elk phos, look at the teeth. We're trying. I just want you to know that. And Jen says, a wish for me would be to have a team of experts who can help look at an individual as a team, a physio, an endocrinologist, massage therapist, nutrition expert, mental health professional who could talk together. Yeah, multidisciplinary teams. This is something we talk about in the healthcare system. And
Leanne,
so
that's what you have at Trio, right?
yeah, we do. We have an
That is,
all-encompassing program. We
yeah.
have the luxury, though, of of being resourced in order to pull that together. And I know that it's not something that's available across the country. and would love to move the dial on that. We know it's needed. We know
Mhm.
it's needed. And Jeremy says, thankfully, we're almost there in Alberta. Alberta has been rolling out Connect Care for the last 5 years, which means an ophthalmologist can see notes from a dentist and that kind of thing. That's amazing. That's amazing. If even the notes, right? That's a start. Jeremy, thanks for sharing that. Anybody else have something that you want to put on your wish list? Right. And does anybody else have anything that they'd like to share this evening? We'll start to wind down the call and we'll go around the room and see if any of the speakers and moderators would like to share anything, or anybody from the audience. First and foremost, anybody from the community that would like to share their thoughts with us as we wind down. Jennifer, do you want to share some summary thoughts here this evening?
Yeah, I'm just gathering them up in my mind here. I guess one thing I would love maybe to launch as a question. It's not a summary thought, but it's a question. Is just what would be the wish list for us as a charity? What could we offer? What could we be doing, like, for our patients to help them with any of this too, right? It's a little different than the wish list from the healthcare per se, but what is it that we could do to help people? I don't know if anybody has any thoughts about that. I know me personally as a patient, I especially felt this way earlier on in our journey, but I still do feel like this regularly, is just having somebody to share it with, to feel less alone with it. Um, you know, that's very meaningful to me. And actually, I spoke to my daughter the other day about this charity and the work we're doing, and she said, yeah, like, she identified how valuable it was for us as a family just to have someone to connect with. That's something that's sort of on my wish list, I would say, as a patient from the community perspective.
Mm. So that's a great question. If anyone would like to pop in the chat, Jennifer is saying, what can Softbones Canada do for you? For you living with HPP or with a loved one with HPP. So would love to hear your thoughts popped in the chat. And Jennifer, can you share with me what are the efforts to connect? Do you have a family forum, an in-person family forum? Do you have a Facebook page? I'm not on Facebook, I'm sorry to say. I
Yeah, we
probably
do.
should be.
Yeah, we do have a Facebook page, but no, we have a very small community in Canada, and we find that many of our community members are very quiet and keep to themselves. And we're not really sure why, but there's a reluctance to share. I feel that some of our patients do reach out to the bigger, more active community in the US, which is great. And I think that perhaps they feel a little more anonymous there too, and so they can share less conspicuously. We definitely really value the input we're getting from our scientific advisory board so that we can put out newsletters to our community, help people understand what's the research going on, what is the state with the new Alexion trials. Like, keep getting good current information to our patients is one thing that we really do try to put our efforts on, but it does tend to be a kind of a one-way communication where we send out. Right now, our patients, when it comes to connecting, the majority is, well, there's questions. We've got two types of questions: seeking access to medication, and we do our best to help orient them in that, and seeking diagnosis. That is really, I would say, 90% probably of the communications we get from patients is they're overwhelmed trying to find some kind of treatment or trying to find diagnosis. So yeah, we would love to have a more active, but we struggle, like, just simply being in this enormous country, thousands of kilometers apart from each other. So yeah, that's
I
an
know.
ongoing question for us.
Yeah. I know we're geographically immense, and I think the work that you're doing is amazing. Michelle says, I think connecting as a group is important. Here we are tonight doing that. And, I'll just say, and I know Cheryl will agree with me, that if there's anything that we can do to help you connect with each other, I've often wondered if we should have a rare bone disease family forum and get individuals with XLH and OI and HPP together and create that sort of critical mass. And because the themes honestly are so common. Obviously, HPP is unique, no question, but there's a number of common themes. And the way that the healthcare system supports XLH and HPP and OI has a lot of commonalities. So, anyway, just putting that out there. Cheryl, what are your thoughts as we wind down the formal part of
Well,
this evening?
I think it's been brought up by a few people that the way to go to best serve the needs of you and the families is having multidisciplinary clinics, for both from a physical point of view and the mental health point of view. And, the message I have is to continue, and we're trying to get the funding. It makes sense from so many perspectives, to have multidisciplinary clinics. And so the message I have is that I think we really have to continue to advocate on behalf of not just dealing with HPP as a bone disease, but as a multi-system disorder involving in many of the issues that Natalie brought up today in terms of the mental health challenges. And that's best served in a multidisciplinary setting. So,
Yeah, thank you, Cheryl. I couldn't agree more. Couldn't agree more. We have a lot of work to do, right? To sensitize the healthcare system to the
yeah,
needs of the patient with the rare disease in general, and in this
absolutely.
case, rare disease in
Yeah,
particular.
yeah.
Natalie, what are your thoughts as we start to wind down the call this evening?
Well, thank you all for sharing and being so, I think, vulnerable with some of your experiences. I think the other place that would be really cool, especially if you were to pull a bunch of people together, was that the concept of just like representation matters and having, a mentorship-esque sort of place that people can come and talk their experiences and ask for advice and problem solve and really develop sort of a sense of camaraderie or community support, even if it's not just HPP, has, I think, been something that other rare disease spaces have found to be really powerful, especially if there's not a lot of you. But having representation and seeing people, living adults who have been like, yeah, I totally get that. I went through that as a kid. And, it's helpful. Like we need that. We need to see ourselves in spaces of success. And so that would be the one thing I think that we hadn't talked about that might be helpful is to start to think about like who are your champions in your community that kids look up to and see, like there's a way to do this.
Mm. Yeah, a mentorship program. Jennifer is someone with two teenage girls. What do you think of that? Some sort of a mentorship program? I know I work closely with the Duchenne muscular dystrophy community as well, and they do have, I've heard many times, yeah, this young boy has this older boy who's a friend, and that's been very empowering. And Jennifer, what are your thoughts there with some sort of a mentorship program with an adult with HPP paired or an adolescent paired with a young child? Does that resonate with you?
Absolutely. I've certainly thought about this, particularly in context of my own girls, and recently had a very nice conversation with an adult in our community who did offer, and I thought that was just wonderful. I told them I would almost certainly be taking them up on that for sure. The idea of making a bigger program, I think it's a wonderful idea for us to think about. We are a very, very small charity, so we have extremely limited resources, but I think something like that might be worth putting on the list, to add to what I said earlier about the way we do connect. Most of our connections with patients, I have to say, is one-on-one. It's one-on-one, us reaching out, phoning or contacting the patients that are on our list. We try to do it about once a year, and we all value those one-on-one relationships very much. It would be nice if we could get a little bit of momentum going as a group, though. I agree. That's something that's been a priority for us for the last few years, and we really have struggled to get it going. So maybe a mentorship program, even if we're just able to connect a few patients, adults, and kids here and there, that would be a great success story. Like baby steps is wonderful, and that would be so meaningful to both the adult and the youth. I think it's a great idea. Yeah.
Mhm.
Thank you for
Yeah,
that. Thank you for sharing that.
Okay, good. Nice to come away with some practical suggestions. So that's really
Absolutely.
great. Does anybody else have any comments or suggestions for
I
where you'd
think there
like to
was a
see us?
I think there was a question in the chat about the aim of the new clinical trials.
Oh, I
Um,
missed that.
it's above your um, message, your chat of 7:23 p.m. above that.
Okay.
That was me, Cheryl. Hi, Cheryl.
Roseanne,
Roseanne, yeah. Sorry,
this is like old
the
home week
lighting
for
in here
me.
is terrible.
This is like homecoming for me.
Yeah.
I'm
Mm.
not seeing that. Maybe it didn't come through.
Oh, it
It's
did. Oh,
higher
maybe
up.
it was a direct message to me. Hold on a
Think
minute.
so.
Yeah, it
But we
wasn't
can,
maybe direct you because I was curious. I'm one of the people who are on Strensiq, the aspartame alpha, and I have been since the clinical trials. And I wanted to have something with a mentorship program because I was diagnosed in childhood, and I'm 69 now, and I've been using Strensiq very successfully, and I've become very mobile compared to what I was before. I had the waddling gait and all that, and a lot of pain walking, and now I'm traveling and hiking and doing all kinds of stuff. So it's worked very well for me. And in terms of mentorship program, I thought for myself, like I don't know whether it's relatable, matching, you have to match children to people who have gone through it and who have lived through the trauma of, for me, I had bilateral fractures. I was running because I had a park ticket and both my femurs broke. I mean, I've been through these kinds of traumatic experiences through having HPP, but uh, applying that to a mentorship, like there are so many different degrees, as you know, Cheryl, of being affected. Some people, it's just the teeth, it's just the nails. There's so many different levels of severity that I don't know. Like you would have to very carefully match the children and younger people to the older people who have had experience with this condition.
I mean, I agree with you, but one of the things that our speaker mentioned is that if we all focus on the ability issue that Natalie talked about and not about the capacity and that separates people, based on ability, um, and confidence and focus on the confidence and the ability issue, then that brings us together and it I guess bypasses all the nuance, the physical nuance differences from one person to another. I mean, every patient is different, but there's many things that are bringing us together. And I think if we focused on ability and help support families through trauma and and the pairing of an older patient with a younger patient. I think that all focuses on providing additional supports to families when they need it.
yeah, and at the same time, as it's been put in the chat and said a couple times, it is a complex and personal disease, and
Yeah.
certainly, different strategies are going to work for different people, or and I think a mentorship program sounds great. Maybe it wouldn't work for one person, but be very valuable for another, and I think it's one avenue that we can potentially, as you said, Jennifer, put out there and sort of think through. So that's those are all great comments. Thank you so much. Um, Cheryl, I think you have a poem you'd like to share with us to wrap up the evening, written by a patient or a
Yeah.
parent, and I
Um,
think that would be a
can
great way
can
to.
I have the ability to share?
Yep, you should. Let me just double check that it's all turned on. Yep, you should be good.
Hold on a second. Are you seeing it? Oh,
No.
yeah, hold on a second. Let's see. Okay, hold on. Share. I want to share this poem. If I can't share it, I'll read it. How's that?
Sounds great.
I'll read it. And it was written by baby Amy, who was 4 months old when she was airlifted by Learjet to Winnipeg from Northern Ireland. She was the very first human in the formal phase 2 trial to receive aspartame alpha. So this was in 2007. And she came, well, I've kept in touch when the infants who were came to Winnipeg, stayed with us for 6 months. And then, of course, she survived, um, and she was able to go home. And we've kept in close contact. And the parents have given me permission, and Amy has given permission to share this information. So she came to Winnipeg this past summer, and she left us with a poem that I'll read. So when I was born, I was already dying. No cure, no solutions, and some would say no hope. I had HPP, soft bones. I don't remember much of when I was young, at my worst from a few months old, but my parents do. The funeral arrangements were made for me, the doctors looking for the key and the constant anxiety. People prayed and prayed and prayed some more. God heard them, and before hope was lost, He answered. A new cure came my way. Maybe there was hope for another day. I got stronger and stronger as time flew by. Walking at 3, I was still alive. Although the time was flashing by, the talk of surgery filled my mind. More and more the words came, but no one really is to blame. The more surgeries I had, the more it felt unfair. Why me? Why now? And why do I care? It's to make me better, and I know that's true. But why are surgeries really nothing new? I am now not surprised when they tell me what is wrong. It's your head, it's your back, it's your legs. Now that I didn't expect. I can't believe it, and yet I can. Because when I look at others and I see some people have it way worse than me. She can't walk, she can't see, she can't hear, yet I can do it all. It makes me sad, but it makes me glad that I'm so blessed. So I'm thankful for the doctors, I'm thankful for the prayers, and I'm thankful for my family for all their cares. I'm thankful for Dr. Greenberg and all she has done for me. And I'm thankful for the Christians who look after my family. I am truly blessed. And that was written by Amy Tinsley in March 2004 when she turned 16 in Belfast.
Wow. It's very powerful, Cheryl. Thank you for sharing that. It just leaves me with sort of tingles down my spine, and it really connects with what Michelle put in the chat saying, what helps me is to try to see the positive and to think I can. And Amy's really done that, hasn't she?
I don't know
Really,
how, she's still facing lots of more surgeries, and yet she's amazingly resilient
yeah.
and focuses on her abilities as though and obviously has a very supportive family. But I give Amy lots and lots of credit.
Mm-hmm.
She has two siblings who do not have hypophosphatasia, and somehow it works for this family. I don't know how they've
Mm-hmm.
done it really. And many families out there listening today have the same resilience and the same strength that Leanne and I see in our patients every
Oh
day.
yeah. Yeah, I mean, I feel so honored to work with this community and others with rare bone diseases. I see this incredible strength of spirit and resilience and positivity in the face of tremendous adversity. And I am just absolutely inspired by it. And I want to thank all of you for the way you come to the table to talk about this and the way you go forward every day with the challenges. And we don't aren't able to completely change the landscape for you. We're trying. We have a lot of work to do, and we appreciate that you're here tonight to tell us what you need to talk about it. It helps us understand what we need to do as we go forward as healthcare professionals. And it's been great to see so many people come this evening, and I hope that you have gotten something out of it. You've certainly shared, so know that you have blessed everyone that's been here tonight in terms of what you shared. So thank you, Jennifer, as well for facilitating, Dr. Truba for being here tonight, and Cheryl for moderating with me, and for everyone for attending. And I look forward to the next time that we're all together again. Thank you.